Right off the bat, how many people, like, how common is ED?
Well, I think you're spot on. And I think our epidemiology, our measures of it in society probably underestimate how common it is for exactly the reason you're talking about. People, they don't want to talk about it. There's a stigma with it. They may be embarrassed. So I'm with you. But if you look at the studies, about 15% of men between 40 and 59 years of age report some degree of erectile dysfunction. Men in their 60s, it's about 45%, and 70% of men over 70 years of age. So it's pretty common, and I bet we underestimate it, particularly in the younger age groups. And I should say, the way that we're defining erectile dysfunction is the inability to attain or maintain an erection sufficient for sexual performance. And you can get, of course, more specific than that. There's a questionnaire, the IIEF-5 score, the International Index of Erectile Function 5. It's a questionnaire. It's 5 questions, and you get 5 points per question. And if you can pull it up online. It's pretty simple. And if your score is between 22 and 25, that's normal erectile function. And then there are grades mild to moderate, severe erectile dysfunction, the lower the scores get. So there's a fairly easy way to somewhat objectively quantify one's erectile function. But I think you're right. I think it's way more common than we discuss. A lot of it can be tied back to diet. There's a variety of things that can cause erectile dysfunction, and they kind of lump them into organic causes, meaning like a physiologic cause or medical reason, a psychological cause, anxiety, depression, or maybe drug related. But organic causes are broad, and they're often vascular or blood vessel related, endocrine, like testosterone or thyroid hormone related, and neurologic, because the nerves play a role in that as well. So diabetes could impact it. But vascular erectile dysfunction, or vasculogenic, is the most common reason to have erectile dysfunction. Now, sure, you could be tired one night, maybe you had too much to drink, maybe you're really stressed about something. Those are things that can also impact it, but maybe transient. But vasculogenic erectile dysfunction is the most common organic category of it. And that is largely due to blood flow into the penis. So getting an erection, and blood flow is, of course, related to diet. So getting an erection is a psychological event. It is a vascular event, a neurologic event, and also the endocrine system plays a role. So if there's some kind of like physical or psychological stimulation, then the endothelial cells that line the artery going to the penis secrete some nitric oxide and help the penis dilate, and blood flows into the penis. So you could see if there is an unhealthy diet injuring arteries, injuring endothelial cells, that could meaningfully impact erectile function. And so the blood flows in, and then it goes into these venous sinuses that slowly fill and engorge the penis. And then when that happens, they engorge, they grow, and they hit up against some fibrous tissue, making it hard for the venous blood to drain. And so when that happens, the penis stays hard, and you're able to have a sexual act. So anything in terms of blood flowing into the penis or blood flowing out of the penis, if there's a problem with that, that can cause erectile dysfunction. Now, in terms of diet, we know that diet significantly impacts blood vessel function, whether it be in a positive or a negative way. And the artery of the penis isn't immune to that either. Atherosclerosis or vascular disease is a systemic disease. It affects the blood vessels in our heart, to our brain, and also to our penises. So what we eat profoundly can impact our erectile function over time. And there certainly are some small randomized controlled trials where they put people on a Mediterranean style diet versus just kind of general recommendation in a Mediterranean style diet, having more vegetables, more fruits, more whole grain, and they saw improvements in erectile function over time. So diet plays a very important role in this.
So let me just see if I can summarize there. Basically, what you're saying is in terms of blood flow, right? So you think blood flow, you think blockage, and blockage, that's a big problem. So then is ED then potentially a sign of worse things to come?
Wow, well, that's a great question. And we frequently call erectile dysfunction the canary in the coal mine for heart disease. Why do we say that? Because the artery to the penis is smaller than the arteries to the heart. So by the time you have a blockage in the artery to the penis that's negatively impacting blood flow to the penis, it's exquisitely likely that you also have cholesterol disease in the blood vessels throughout your body, including to your heart. But those are bigger blood vessels, so it may not have clinically manifest. But typically, when someone has overt vasculogenic erectile dysfunction, we call that the canary in the coal mine because it often heralds future cardiovascular events, often within 2 to 3 years after a diagnosis of vasculogenic erectile dysfunction. Someone may develop angina or chest pain, poor blood flow to the blood to the heart, the muscles of the heart. And about 5 years later, they may actually develop an overt cardiovascular event like heart attack. So you're absolutely right. Diet impacts blood vessel function. Diet impacts erectile function. Erectile function is the canary in the coal mine for cardiovascular disease or heart disease. These are all tied together. It's a common theme.
At what point, though, should somebody become concerned? Like what frequency, if it's happening more than a handful of times?
Yeah, I think so. I mean, it's hard to define that precisely. But if you don't have like an overt reason for it having happened a couple of times, like you haven't slept, you don't have maybe you drank too much, like you were saying, maybe you're super anxious about something. So if it happens a couple of times, I don't get too concerned if you have that kind of reasonable explanation. But if it begins to happen consistently, and how do you define that? Don't know exactly, but I guess I would define it as happening when you don't have an obvious, overt other reason. Then it's very worth talking to your doctor about it. And people can feel uncomfortable about talking about it, and you can kind of sense when a patient wants to talk about it, they kind of get an uncomfortable look in their eyes, and you want to make them feel, of course, as comfortable as possible talking about it, because the kinds of risk factors that can lead to vasculogenic erectile dysfunction are the same ones that lead to coronary artery disease, high blood pressure, diabetes, high cholesterol, diet, lifestyle, et cetera. And those are things, smoking, and those are things that can be addressed in the physician's office and by the patient. So if it's happening, on a somewhat regular basis without an overt alternative explanation, talk about it with your doc. So, like docs have, been around the block, seen a lot of things. You go through training, you see all kinds of stuff. And I understand that it's uncomfortable. I understand it's embarrassing, but please bring it up with your doc. They should not feel uncomfortable talking about it at all. If they don't have a lot of experience with it, they could very easily refer the person to a cardiologist or a urologist to help them with the issue. But please bring it up. There are randomized trials with the Mediterranean style diet, which is more plant-based, where people do better. Stopping smoking, they can do better. Losing weight in randomized controlled trials, they do better. Exercise is helpful. All those things are helpful for health in general and also for erectile function. But whether a fully plant-based diet can reverse it, we don't honestly know the answer to that. My hypothesis is yes. And I base that on extrapolating from data of the randomized Mediterranean by Esposito, the Mediterranean style diet trials where that helped. And of course, it's more plant-based. And your group, PCRM, did a wonderful study comparing a plant-based diet to a Mediterranean-style diet. And they saw that on the plant-based diet, people lost more weight, their cholesterol fell more, blood pressure fell more in both groups, but more so in the Mediterranean arm. So there's benefits in both, but seemed like overall more benefit in the plant-based arm. Now, erectile function wasn't an endpoint in that study that I recall, but and you can extrapolate from other data that consuming more plant-based nutrition under the umbrella of a Mediterranean-style diet might be helpful. For example, in the PREDIMED trial, which is a randomized controlled trial of people at risk for cardiovascular disease, but didn't have overt cardiovascular disease, probably enriched for erectile dysfunction. And they were randomized to a Mediterranean-style diet versus basically a Western-style diet. And those randomized to the Mediterranean-style diet did better long-term. They did an a priori defined post-hoc analysis of that study, and they found that those who ate more plant-based nutrition under the umbrella of a Mediterranean-style diet did better, had lower mortality. So one could hypothesize that based on that, it's probably also helpful for erectile function.